there's been some glitches and some bumps, and are you concerned that maybe some people, they go on the system, the website, they can't get through, they get frustrated, they go, this whole thing's a disaster, and they don't even bother to come back?
Well, I think our message is please take a look, because I think there were some rocky moments at the beginning. There are improvements being made every day. We're working very hard with the 24/7 team. We've added hardware to make sure that we can handle what is a higher than anticipated volume. And we're fixing some of the software issues that bump people. So we're open at healthcare.gov. The product is great. There are competitive plans at an affordable price, and I think people will be very pleased with what they see. 26 weeks of open enrollment lasts all the way till March of 2014, and we just hope if people were frustrated day one, they understand that this is a kind of different sale than a holiday sale. The product will not run out. There'll be insurance products on the marketplace the whole way, and the price does not go up. The prices are locked in. So visit the website, call the toll-free hotline at 1-800-318-2596 and talk to somebody who can walk you through, or come to a community health center in Cincinnati, to the Cincinnati Health Department, to the food bank, to a variety of organizations who have counselors trained to sit down with folks and help answer their questions.
I mean, I guess it's good that in a sense it's overloaded because it shows that people are interested, but do you have a sense as to how many people have now signed up and or have been turned away? Does it keep records like that?
Well, no one has been turned away. The website
rejected,
may have,
right.
out, yeah. What we will be making monthly enrollment reports, because enrollments are coming from all over the country, not just the federal site, and from paper applications and phone applications. But what we know is hundreds of thousands of people have come to the federal site, are very eager to enroll, and that's good news. People have waited a very long time for affordable health coverage. It's finally here, and we are really working hard to make sure that their experience on the website or on paper or on the phone is as easy as possible.
I know there are the navigators or the counselors. I mean, you're concerned that people, the taxpayers, even who may not be using them, are getting their money's worth? There's a lot of money for those folks, 67 million, I think.
Well, I think we would love to have far more navigators. This is an important decision and a complicated decision. It's more than buying a toaster or a television or a car. It really is about your health. A lot of the potential clients have never had health insurance, so understanding what a deductible is and what a monthly premium is and what the benefits are that they're entitled to, how that works for them and their families, are important conversations to have. So having some folks on the ground to answer those questions, but again, people who have a computer, there's a whole learning side of healthcare.gov to walk people through insurance, and there's also a what we call an anonymous shopper experience. So before you go and submit personal information, you can actually pull up the Ohio pages, see what plans are available in Ohio, learn about them, think about them, have family conversations, and then go to the enroll side and make a choice.
Do you think there's any confusion out there, particularly with the state of Ohio now maybe going to do Medicaid, for the expansion rather, and people going, well, am I on Medicaid? Am I on this? Am I on Medicare? People who don't have employer coverage. Do you think there's that?
Well, if you're over 65, you are entitled to Medicare, and you should be enrolled in Medicare and stay in Medicare. Plans change a bit year to year. The drug plans change year to year, and open enrollment for Medicare is underway right now. But you shouldn't worry about the marketplace. If indeed you come into the marketplace and it's clear you are eligible for Medicare, you will be sent back to Medicare. For individuals who really aren't sure where they fit, they don't have to figure it out. The Navigator will help them, the website will help them. It's really an income-based determination whether they qualify to get a subsidy in the marketplace with private insurance plans, or they qualify for Medicaid, which in Ohio is run by private insurance plans. So they can enroll, and they will be sent to the proper plan for their choice.
All right, good. Last question. Let's see what it is. All through American history, we've seen huge controversy and opposition to Social Security, which was an expansion of assisting people, Medicare, Medicaid, and now this. Do you think, and we're seeing efforts now to blow it up, although that doesn't seem to be working, how confident are you that history will look back on this and go, this is the big deal that we think it is?
Well, Republican and Democratic presidents for over 70 years have talked about comprehensive health reform. President Obama really chose a market model. He did not want to blow up the insurance that 85% of Americans enjoy, leave those plans in place, and kind of build on it to fill the gap with a market strategy. Private plans having to be competitive, offer choices, offer good prices, and that's really what we have. So this has been a long time coming. There have been millions of Americans without health security for themselves and their families, and a lot of people locked into a job that they may not like or may not want, but they're terrified to leave because of insurance, or they may not be able to retire early because they're afraid they won't have affordable coverage, or they may not be able to return to grad school. This is really an opportunity for people who do not have affordable coverage in their workplace to really make some choices for themselves that work, and have the federal government help to contribute to their health care, since their employer doesn't pay a share of their health care.